statement.
All right, so virtual meeting statement pursuant to Governor Baker's March 2020 order suspending certain provisions of the open meeting law, general law, chapter 30A, subsection 18, the governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place. The meeting of the Hubbardston Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and or parties with a right and or requirement to attend this meeting can be found at www.hubbardstonma.us. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event we're unable to do so, despite best efforts, we will post on the town's website an audio or video recording, transcript, or other comprehensive record of proceedings as soon as possible. So with that being said, this meeting is being recorded.
Okay.
Kate, I don't know. Al is here for the Board of Assessors, which is under new business. Him and Ryan were discussing having in-person meetings, and Ryan requested that he come to the Board of Health meeting. So I don't know if we want to vote to order the agenda.
I think we can reorder the agenda as needed if you would like. Anybody opposed? Any conversation on the topic?
That's fine.
All right, Mallory.
All right, Al, you have the floor. Oops, can you hear me? Al?
He has his mute on.
Yeah, Al, you're on mute. So if you want to take yourself off mute, it's in the lower left corner.
Can you hear me now?
There you are.
Yep.
Very good. Thank you. Sorry for the difficulty. I'm hoping the chairman of the board, Mr. Prentice, will be able to call in and partake of this opportunity. I want to thank you all for allowing us to speak to you this evening regarding the possibility of having our meetings be open and returning to pre-COVID status as far as our meetings are concerned here within the town of Hubbardston. As we all know, over the past 9 months has been a challenging time doing everything virtually as well as electronically, trying to get people to become more accustomed to it and working together. Unfortunately for our board, we feel that we work better together when we get to see each other and speak directly with and to each other. Quite often during the course of our meetings, we basically go over some information that's been provided to us and signed papers. Is Mr. Prentice there? I thought I heard somebody in the background.
Nope.
No. So the number of people that we get who are not board members or affiliated with the board is very limited. On occasion, as all the boards here in town, we have what I'm going to define as a hot button issue, where there will be more than just the board members and their informative staff there with us. Most people at that time, it can maybe go maybe 2 or 3, maybe 4 additional people to the board. But we've never exceeded, in my past decade, I don't believe we've ever exceeded 10 people at any of our meetings. So with that in mind, since it's just a 3 board member and a clerk that we use to provide us with the paperwork that we generally need to sign, we're asking that we be allowed to return to in-person meetings there in the Slade building.
Okay, thank you. Members of the board, you want to chime in? Do you have opinions, questions?
Well, the state has just put us back to stage 3, phase 1 as of today. So I'm not sure how that impacts town offices.
As of the moment, I have not seen anything at all detailing, as you note, what will be incorporated under this new phase 1 plan. So I don't know if I have been told verbally by somebody in town, not affiliated with the board or with town government, that up to 6 people can still congregate together, for example, at a restaurant. We don't have 6 people on our board, and for the most part, we never have 6 people at one of our meetings.
Al, you guys
We
can't,
usually have 5 or less.
Al, you can't do your signing of documents over virtual, right? It has to be a what signature?
Correct.
Because a lot of this is going towards like the tax rate and all that good stuff. So I can
Tax
understand.
rate, abatements for cars, motor vehicle, property, stuff that's come up through the tax collector who wants to put liens on property here in town, et cetera.
So it would be a 3-member board plus your clerk, and then because in, like we say in the open meeting statement, it still needs to be broadcasted to Zoom Live. So there would have to be someone from the cable committee running the Zoom meeting for them so that it can be broadcasted live and that members of the public can join via Zoom.
Our board is yet to have a member of the cable commission or a representative of the cable commission come in to videotape one of our sessions.
Right,
I'm not-
now they would have to.
Okay, because they haven't in the past, I'm not
Right,
including them in our total count. Okay,
right. Well,
so
yeah, it's
with that in mind, we could still, if all we're doing is signing papers, we could still be under 6 people. And our theory was that if we met in the conference area near the tax clerk and the town accountant, we could all maintain social distancing of 6 feet or more because there's only 3 to 5 of us, as well as wearing a mask.
Have you talked with Ryan about this?
Yes,
Al, when do you guys meet? Do you meet during a business day?
we meet evenings monthly. We haven't met at all during this time period of the COVID crisis.
Okay,
So
so
our
you guys
meetings have all taken place when possible virtually. So
okay.
we always go into the office individually, or maybe we run into each other. We go in, we sign the paperwork that needs to be signed, and we leave it there.
Yeah, and I can find no update to the open meeting guidelines since March. They weren't reviewed or rolled into the phased rollout and reopening plan. So they were just left as status quo. Just for what it's worth for the board. But, you know, with 3 or 4 people spread out, I think that if you follow Mallory's advice and actually have the Zoom meeting set up so that members of the public are informed and able to connect remotely, but the board itself is in the building without members of the public being allowed into the building in person. I personally wouldn't have a problem with that. You know, it's one of those things. I know a lot of people, a lot of boards would like to do that. They tend to be larger, and it becomes more difficult the more people you have, obviously.
You have space? Is there room designated that's big enough to accommodate, because 3 to 5, because you're the clerk in there as well. So you're talking 3 to 5 people?
Well, I was anticipating that the conference area where the assessor's office is, the town accountant is, the tax collector is, as well as the town administrator would be made available. And that room appears to be big enough to allow for 6-foot distancing from all attendees.
And the other thing that I'm not so convinced about that being big enough. The other one is the rates are rising like 2% a week. Even in Hubbardston, we are rising 2% a week. And the Gardner is in red. They're 10%. So I'm not sure the feasibility of this whole thing.
Ben or Colleen, do you have anything to weigh in on?
No,
I think it's a matter of timing. I think the Board of Assessors is probably one of the, if not the only 3-member board in town. And I do think that area where the selectmen meet would be able to accommodate a 6-foot space between everybody. It would have to be published and posted very prominently that no spectators would be allowed, and they'd have to participate through Zoom. But right now, I think Judy's right. It's the timing situation. It's maybe if we waited a couple weeks and see if everything subsides, but that would be my only concern. I think you could logistically do it, but do we want to do it? That's my question.
I have a
Never-
question. I do have a question for Mr. Afonso. If you can't allow the public in, can somebody make an appointment with you to come as one person to meet with an assessor?
I don't understand. I apologize. I don't understand the nature of your question. I think you guys are focusing more on the fact that public may not be at our meeting. A lot of our meetings don't involve issues where there's a resolution in between aggrieved parties. A lot of times we will meet strictly to sign paperwork, sign tax abatements, property abatements, things of that nature, where there is no quote unquote informal hearing being held to get both sides of the story or to explain to someone why their property assessment has gone up or down, et cetera.
So right now, town hall is open by appointment only during business hours, Colleen. But someone can call and make an appointment with the assessor when he's in, when George is in, or when the clerk is in, if they have to file some paperwork or need to pick up an application, or if they have a question that is, someone's needed to come into the office, they can do it that way. But we're by appointment only. Our doors stay locked. You make the appointment time, you knock, someone comes masked, answers the door. We're doing temperature checks and keeping a log of everyone that comes in, temperature checking employees. So you can meet with the assessing department that way, the
Okay.
general public.
All right.
Everybody would still have to be masked at all times.
We fully understand that and we fully intend to comply.
And there would also have to be sanitizing afterwards, after every meeting as well.
Right, you'd have to pay
If-
for someone to do that.
Mhm.
Can you repeat that again, please? For the sanitation
Yeah,
requirement?
the protocols are that everybody, in addition to social distancing and masks, and hand washing, that, after meetings, every meeting, that, you have to have some sort of protocol for sanitizing the building between meetings. So afterwards, you would be responsible for wiping down chairs or whatever you touched.
Wouldn't the people who work in that area have somebody already assigned, some janitorial service or some janitor on staff that would do that before the start of the day or at the end of the day?
I don't know what's going on in that
Nor I.
particular office.
Nor I, it would just seem,
Yeah,
because if that is I don't doubt what you're saying. Let's start with that, okay? I fully understand you've got information that I am not access to on a detailed basis or a daily basis. But as Mallory just noted, you can make an appointment, go into that section where meetings are held. That's where people can access the assessor's office for detailed or specific information. I don't know if they've sanitized the building after meeting with the general public, even one-on-one.
So we do. We have a janitor who does like a scrub down once a day. But it's not guaranteed which department or which office he's going to start in because he's responsible for police, fire, DPW too, senior center. Once we have someone come in, the staff of that building has kind of assumed responsibility for wiping down any areas that were touched. We require sign in. So we have a cup for clean pens versus dirty pens. We wipe down the dirty pens when we notice there's one there. We have the alcohol wipes. And then Lori and I are constantly, if someone comes to our desk, or to our windows now, we sanitize the window.
The meeting place that I'm proposing that we meet in is right in the triangle of the police department and the senior center. So any janitor probably passes through that en route to one of those other two areas.
Well, the recommendation is that anybody who has a meeting at any place, you know, they're responsible for making sure that, you know, everything gets wiped down before they leave. That's the general recommendation.
Right. And there are cleaning products, wipes that can be used.
Really? Oh, I was.
So I'm not crazy about the idea, only because I'm looking at what I'm due for a job, and my job is following positive cases, and the rate is, you know, my caseload is tripled in this past 5 days. So I see the rate going. I know Gardner's in the red now, has been in the red for 2 weeks. We've managed to, as in Hubbard's managed to dodge the bullet, but how long are we going to be able to dodge that? Ashburnham, the last time I looked at them, they were yellow, and that's the town next door. And they're spread out like we are.
Yeah.
So,
But
Once we get there, then we're going to be closing completely to the public as well too. So I have a feeling it's only a matter of time until we can't offer the appointment by appointment only, and it will just be the staff that's working.
When's your next meeting, Al?
you know, that's a good question. We have one scheduled for the 18th of this month. But Ryan had reached out to me late last week about having a meeting with representatives of the RRG Corporation, and that would be the president of the corporation, Harald, as well as one of his underlings, George. So that would be 5. I don't know if Ryan, I think, was intended to access it via Zoom. So we would be at 5. Maybe with the clerk, yeah, with the clerk. We're going through transition now with a clerk, so that's kind of a little up in the air. So maybe at max, we would be 6. But that would be the 18th. 18th is a staff meeting, assessors board meeting, and this other meeting that Ryan has proposed, I'm not really 100% sure on the date.
6 might be tight there.
Yeah.
All right. Anything else from the board? Should we make a motion on do we want to vote on this? Is this just a discussion?
You know, the interesting part about all of this is that the reservations that I have are based on the concern for the health and safety of the participants involved. And I know we're all adults and we all want to take these risks, but ultimately we come down to a community type of responsibility. And do we set a new precedent and have a situation where now every month somebody else is coming to us? I'm not sure what I'd like to do about this. I really have some reservations about it, but and it's
I'd like to suggest that the meetings not be in person until at least the end of January. when some people are going to start getting vaccinated and see where that goes. I think our numbers are very high right now. And the risk to you, Al, is pretty high. If you get sick, you're not going to fare well. And I don't want to see that happen.
I guess another fear we have to have too is that what happens if there's an exposure with.
We do thank you for your concern on our behalf. I know you guys have met and had this topic presented to you from what I gathered previously, but here within the town, I go around as probably as many of you do, and whether it's the town hub diner, the Pizza Palace, other areas where people congregate, I'm not sure there's some type of consistency in your goal and how it's applied throughout the town. It seems like you want to have a lockdown for meetings, but other businesses in town where people congregate, sometimes for more than 15 minutes, even then more than 90 minutes, I guess that was one of Governor Baker's most recent comments, seem to operate without impunity. Yet we're just trying to get 3 to 5 people together, and we're having a lot of difficulty.
Yep, but you need to also understand that what we're doing and what we're actually following are the guidelines set forth by the state for public meetings, and then separately for businesses in a phased reopening. There's been no change to the meeting policy, and 3 people, it's pretty acceptable. But you yourself said on the 18th, it's going to be more like 5 or 6 people, and then potentially another if you need to have a cable person come in and then film it and have Zoom available for the public beyond that. So
that particular space is too small.
it becomes an escalation point. It becomes, it starts with 3 people, but then something else happens and someone has to be added. And then there's more and more added risk. We're not trying to unduly punish any one board or preclude people from doing their job effectively. We're trying to just uphold the state mandates that we've been passed.
And I understand what you're trying to say, because there's a lot of discussion on DPH conference calls about just exactly this, because people are always trying to push and see where they can go and where they can't go on these meetings. So I totally get what you're saying. But meetings are not recommended, and actually businesses are going to have to start cutting back on how many people they can allow to be there for any length of time too, because like I said, the rates are going up by 2%, 3% a week in each community. So I've really been afraid to look at what the overall state rate is, but I know Gardner is up well up over 10%, and I think we went from 3 to 5 in a week.
If I'm incorrect, I'm sure you ladies and gentlemen will correct me, but most recently, hasn't the information for rate increases or percentage increases been specifically tied to people traveling outside of Massachusetts for the Thanksgiving holiday 3 to 5 day season?
We're beyond that.
No, it's yeah, just like she just said, it's beyond that. What we're also seeing is right now we're seeing community spread, and we're seeing entire families go down. I have a couple of families I'm following where one family is completely everybody has it. And the other family, one member managed to skip out of it, but the other 3 members have been sick. So
But yeah, but the question is,
that's
isn't the
what's
passage,
happening now.
the passage of the corona from person to person took place at a family gathering?
No, not necessarily. A lot of them have no idea where they picked it up. They haven't done anything but make quick trips to the grocery store and back home again. They've been, I have elderly couples who they've done nothing but, hibernate. Um, and then they go out to the grocery store and the next thing they know, they're both sick.
Kathy?
I guess I'm not interested in having in-person meetings. We can revisit this again in January, and we would gladly do it then. I don't think that we can support having in-person meetings at this time. I'm glad to review it every month, and that's not a problem. We'll put you on the agenda again for in January, the first meeting in January. I don't see allowing any changes for any of the boards in the town at this time. And we'll be visiting those restaurants later this week.
Thank you very much for your time. I wish you all the best of holiday season.
Thank you, Al.
We'll be seeing you later next year. Thank you.
Thank you, Al.
I'm muted. Mallory, you're on mute. I don't know if your connection is lost, but
Yeah, my connection's not being great tonight. I heard, okay, but I did hear that.
I'm going to go back to the agenda if I can find it. All right. To the top of the page, we're going to review minutes from the last meeting on 11/24. Did everybody have a chance to review the minutes as submitted?
Yep.
Any changes, edits?
I didn't seem to get the minutes, so everybody else look at them for me.
I
It
absolutely.
looked good.
They look good to me. I'll make a motion to accept the minutes as written for 11/24/20.
Second.
All right. All in favor? Colleen?
I can't vote on this because I wasn't there.
Actually, technically,
I
you
did read
can
them.
if you read them because it's
I-
for edits and typos, but that's
Oh,
okay.
okay.
If you don't want
Oh.
to, that's fine.
Nope, no edits and typos.
And Vin,
Yes.
Judy,
Yes.
Kathy.
I'm abstaining because I haven't been able to read them.
Oh, okay. And Kate is a yes.
Kathy, are you sure you didn't get them? Because I sent them out in a group email to everyone. Like if you got the agenda, you should have gotten the minutes. Everything was one email to everyone.
Yep. Meeting info for tomorrow.
I don't know. Somehow it didn't come through. It's weird.
All right. In any event,
We'll just keep going. Don't worry about it.
COVID-19 update. There's nothing listed, but is there a general update?
Yeah, general update goes along in lines of what our numbers are on the rise. We're at 11 cases right now. Just like Judy said, we are seeing it more so in families, 2 family units right now that have multiple members down. The state did issue us back to the stage 3 phase 1. So pretty much where we are. It's not looking good. Numbers are not going the direction we want. And we're just going to have to keep vigilant on it.
They, yesterday they put out a whole new set of guidelines, because every week they say, oh, everything's going to stay the same. And then Friday afternoon rolls around.
Yeah.
So they put out new guidelines for quarantine and isolation. So they shortened it up. They've just found that the incubation maxes out between day 4 and day 6. So they're allowing people, if they haven't had any symptoms, by the time they get to day 5, they can get a test, and if they're negative, they can get out of isolation on day 8. If they opt not to get a test, then the isolation is all the way to day 10. So there's a lot of new research coming through, a lot of new data that's being analyzed, and the new guidelines are 5 pages long, and I'm still trying to work my way through to see how it impacts the work I do. But, you know, I can send them along, and so everybody will have at least a copy of them.
That would be great.
Judy, I have a question too. I don't know if you've run into this, but we got the phone call or email about someone who has adopted a dog in New Hampshire and wants to cross state lines. And what do they have to do? Are they required to quarantine? And then I also had, I directed her to 211 because I didn't know the answer. She has a second home in New Hampshire. Is she unable to use it right now, or?
She can go up to New Hampshire and she can stay there, but she needs to be aware that when she comes back, she needs to, that's a travel restriction. So she's going to either need to quarantine for up to 14 days or get a PCR that says that she's negative.
Okay.
Within a certain time frame when she gets back too. It has
Right.
preferably within 2 days before she comes back and crosses the borders.
And I know you can like cross the borders for grocery shopping and stuff like that, but what about, we obviously haven't gotten specific guidelines on animal shelters or anything like that. But
Right. Yeah, right now there's nothing on
Nothing.
that. No.
So, which is strange because a lot of especially around here, a lot of the shelters are just across the border and.
Right.
Okay.
And the pets can get ill with COVID too. So, but
Yeah.
but beyond being, you know, little hyper aware of, you know, that pets can also get sick, there really hasn't been much out there.
Right. Okay. Thank you.
I'll see if I can track down more information for you.
I couldn't find anything, but yeah, if you find anything, feel free to pass it along.
Okay.
And
Mallory?
oh, go ahead.
I'm not getting any information from you on the number of COVID cases, so I can't send out a weekly blurb for Ryan to post. So would you start keeping me up to date on that via the?
I thought we were just going to go off the weekly report that DPH posts on their website. That's why we were waiting till Thursdays and Fridays. But I can start forwarding that along.
Yeah, just so I have an idea what's going on. I would appreciate that.
Sure.
Yeah, because that's what I was quoting, was that weekly report. It comes out Thursday evening, Friday morning.
But I'm not seeing that either.
I can send you the link.
Right. So during the last meeting, we talked about next steps for internal planning for COVID-19. Do we want to tackle that here, or do we want to wait for a new business to tackle that?
Well, what's the date, the 23rd? Where did that come from? On the agenda, it says the 23rd for the EDS drill. Is that what Jamie set up?
It was an email that was forwarded that we're going to discuss under new business. What I'm talking about is we had talked about having a separate subcommittee meeting to plan for or plan and or discuss, rule out, whatever, any kind of planning for a drive-through, vaccine clinic, etc., or setting up vaccine clinics. Do we want to tackle that topic here under COVID-19 or handle it under new business because it's not delineated in the agenda?
If it's not down below. Let's do it now.
So we had discussed it. Colleen got volunteered without being present, and I know she has opinions to share about that. And then we really haven't taken the next step to set up a meeting or, whatever. So I want to hear what people are thinking, what they have to say. I know we also saw an email come through around the regional, I can't remember her name, having
Amy Terry.
a drive-through with the QRSD.
Yeah.
So what are our thoughts on that kind of planning? Is it something we've also seen and heard, and I know more than just I have, that, CVS and Walgreens are, out in the world saying they're gonna handle this town by town and set up clinics. Do we want to pursue a subcommittee? Do we want to work with a regional group? Do we want to work with an existing pharmacy? What are the feelings of the board on that?
Well, officially, Jamie Terry said at last week, I mean, I've been to like 3 or 4 EDS drills, but officially the government, the federal government, much to everybody's surprise, is said that they were going to contract with Walgreens and CVS. But right now that contract is only for nursing homes. That's what we've been told. So right now DPH is looking at small communities, big communities, whatever, to be really gearing up to have some sort of plan in place and ready to go, because there's 300 and some odd million of us, and CVS and Walgreens ain't going to be able to do it all. So the plan right now is the state is expecting to get doses and distribute them through their system, which means their system would come down to us. The other thing is, I think it's going to be 16 and above. So right now, as of yesterday, it's not going to be children yet, because they don't have enough sufficient data to say yay or nay to the kids yet. I think that's coming, but right now it's not there. They're saying 16 and above. So that's pretty much where we are. Right now, the state is expecting that cities and towns will be doing clinics for the general public.
Okay. Anyone else want to chime in? You guys are killing me with the energy level tonight.
Oh, sorry.
It's sober, too sober.
So yes,
A
we do
repeat
need
the
to
shot.
get a subcommittee going together to get it done. Because before we know it, it'll be upon us.
Mhm.
And Colleen,
Woody, we
you don't
need
have
your
to
help. I'm
you
sorry.
don't have to be thrown into the committee if you do not want to. We don't actually volunteer people behind their back, but it was a fun joke while it lasted.
Well, Judy sent me a message as to what I was volunteered for, and I read it. And the Board of Health stuff in the trailer. I'm going to do that. I mean, we had already talked about that before. And the just-in-time booklet, I'm not sure I know. Is that about the vaccines and stuff? I'm not sure what that is. Did you make that up just so I had something to do?
Yeah, just in time is little booklets that you put together. They can be something as simple as a card or two with basic information. Mostly it's for those that would be working at the clinic. So if you have like somebody that's doing the registration piece, and you just have a card with all 1, 2, 3 steps on it, and then then of course a nurse would have all the doses for the vaccine. somebody else's greeting, and these are the things you're going to screen them before they ever walk through the door. So it's just basic instructions that you give out, and like I said, it can be just something simple like a card, but
Didn't we
It-
have those at the
just in
last
time.
EDS drill? When we did the Hubbardston School last year?
Did.
That was, so, but something more, what do you want? Something more,
something more compact. Yeah, I give them out to my nurses all the time whenever we do a clinic. I make sure that they have the card so they know what the doses are for each age, and all that stuff. So it's just something that MRC units do this, so it's something that we can bring into the picture.
okay. The third thing is, no. The contact the school for EDS drill race. I don't know. I don't want to get involved in that, but I can certainly do the trailer and I can do the cards, but I don't want to get involved in that
The school,
that side of this.
I can handle the school stuff.
Okay.
Just put me down for that part.
We just need a date. I think that the school is available to walk through.
Well, you asked where the date of the 23rd came from.
Yeah.
That's the date of the Quabbin EDS drill.
Yeah.
I
Is that
sent out the last email to everyone to see if they're interested in participating.
Yeah.
That was what that was for.
Well, I'm already signed up to go over there.
Well, I would be willing to go with you as a CERT team member.
Okay.
If you, because you mentioned that you wanted some CERT people if they could go.
Mm,
But now I've never been to the Quabbin school ever. So, of course, I was never at the Hubbardston Center School either, but I don't mind going to this one.
it's funny, but I haven't been to the Quabbin Junior High School either. My kids were there when they were doing the construction at Hubbardston, and then they moved on to the junior senior high school, and they were there for the construction of the junior senior high school. So they spent 6 years in construction, and I've never been inside. So it'll be interesting. And, it will be good to get over and walk through the whole thing and see what their plans are.
Right. I thought it would be kind of interesting just to see what they were thinking, because that's a much bigger school, I would imagine. And they probably have plan, a plan that we could probably go by.
Yeah.
Not that the plan that you have isn't good. It's great, but maybe they have something else that you could add to it,
Yep. One of the things that's come up at the EDS is to take a look at something called signup.com. There's one that I use, signupgenius.com.
Mhm.
Sign Up Genius doesn't have the capability, at least I've only used it a little bit, but it doesn't seem to have the capability to be able to, when people sign up to come to an EDS, they want, they don't have the ability to do it in 15-minute increments, but supposedly signup.com does. So that's something either Katie or Mallory can look at. Maybe because you probably understand it better, but
Yep.
that's one piece.
So you're
and then-
looking to make it so that individuals sign up for a 15-minute time slot.
Right.
Okay, I
And
can take
then
that.
the other thing that keeps coming up at the EDS drills is, I just lost it. Well, we have to have a plan, and there's been always some discussions about how you're going to get the vaccine there, etc. I just lost my train of thought, so
That's fine.
it'll come back.
So I'll take that task of following up and looking at signup.com and seeing how it works. And I'm familiar with Sign Up Genius. I think you can do it, but you'd have to create like a bazillion line items for every 15 minutes
Yeah.
within a day.
Yeah.
Yeah.
MIS where are we at with that? That's the database that when people do come through, that's where you add in their name and then it records the date.
Right.
Yeah.
So right now, the only person that the town of Hubbardston has signed up for that is Sandy. When I tried to get signed up for it, they told me that because I wasn't a nurse, I couldn't. So they had Sandy who has access, but they wouldn't give me access.
For MIIS?
Yeah, that was a big fight because it was under the previous admin, and then she had like a bunch of passwords and questions that we didn't, and it had been signed up for so far long ago that even if someone could remember them, it would be a miracle. So we're trying.
Well, before MIIS, we had, I had an I created an Excel program, which also allowed it, record it and with columns. So I think for this year, you need especially column date, address, person, address, telephone number, whatever you want to include. And then most importantly are the two dates that you're going to need
Right.
to get back. Notification, that seems to be a headache for everybody. Nobody knows quite how to handle that. How do you get everybody to come back the second time?
Especially if you're not feeling well after the first round.
Yeah, I mean, with that, if we actually have, if we have access to a data system like MIIS or to a spreadsheet, and somebody comes in for vaccine 1, I can actually do things and lots of fun things in Excel. Like I can generate what the next date for the second vaccine should be, and whether or not they checked in and or they signed up and showed up, and we can cross-reference all of that.
Mm-hmm.
If we are tracking when people show up in an Excel spreadsheet as well, with the date that they showed up, because I can just compare them and merge them and tell you, here are the people we have to do a call down list to get them to come in for the second.
Right.
So I'll take that as like a task because I'm good with data. And it takes me all of 5 minutes to do those comparisons, as long as everybody promises that we use Excel and we use it logically. That's all I ask.
There's some smaller details too, like when I run the clinic over in Rutland over there. I've provided them with just little business cards, and we give them out to everybody that they've received the influenza vaccine on such and such a date. And then, all right. And then we can do that. We can set up a little card, and then that will be a reminder card. And it also will serve as something they can take back to work that, yes, they received it, because we'll have on one side the Board of Health, all the information, address, telephone number, etc. And on the other side, their date when they received it, what they received. And it can be also set up that you can leave a space so you can put a little sticker across with the lot number and everything else. So everything's, you've got it that way, whatever information. So if anybody gets into trouble with it, with side effects, then we've got, data and information already set out there.
Okay.
Yeah, I
Making
thought
sure-
they were talking nationally about having a vaccination booklet or folder, little pocket thing just for the COVID vaccine. But of course, haven't seen anything yet.
Yeah, those are those VIS. Those are those pieces of paper that they hand to you that nobody ever takes. They always leave it behind. So yeah, there is one coming out.
Now, in terms of the subcommittee and next steps dates, do you guys want to pick a date for a meeting? Because we need to post it.
Whatever I can usually flex pretty good. Tuesdays and Fridays I have Maven meetings, but the other days are pretty wide open.
Gotcha. Colleen? Any preference for dates?
Well, would that be this month or would that be in January?
I'm gonna try for like the first Wednesday in January.
Okay.
You want to
Uh,
wait that long?
Well, this month is going to get busy. It's Christmas. So that's the thing. Plus I have a couple doctor's appointments. I got my book right here. I don't do the phone thing. I do the book thing. So Wednesday's good in January. I mean, if you want to, but I don't know. What do you want to do? Do you want to do a day this month? I mean, just say what day you want and I'll just tell you if I can go.
Well, I thought that maybe we would benefit from you and Judy going to the Quabbin one first before we did anything else.
That's
Okay.
on the 23rd. How about the
So
30th?
that's like 2 days. So that's the 23rd. So when you get into next year for January on what is that, the first, you want to do the first Wednesday?
That's what I was suggesting.
I got to get my new book, which I haven't written in yet.
The 6th?
Yeah, everything's pretty blank in January so far. Yeah, that's good. That's fine.
The January 6th?
Yeah, is that good for you, Judy?
Yep. So far.
So what time is this supposed to be? Is it during the day or?
The one on the 23rd is at 10 a.m.
Right.
January 6th, this would be a planning meeting.
Just for us, right? Just.
Yep. Mm-hmm.
Well, any time of the day is good for me. I don't care. I'm
Why
around.
don't we make it during the day so that Mallory can do it from work?
Okay. Yeah, that's fine. Any time of the day is good for me.
Keep her evening free for her kids.
I appreciate that.
All right, what time? Because then Mallory, your next step is going to be, you're going to have to post this, right?
Right.
Well,
So
let's
do you
try
want to
10 a.m.
Huh?
How about 10 a.m.?
That sounds good.
Okay.
That
I'll
with
get
you?
out of bed.
What?
No, that's my coffee time.
Bring it with you.
All right,
10 a.m.
10 a.m. All right, anything more on the COVID update? All right, moving on to the next item on the agenda. If I get
I
back
love
to
this
something.
retirement.
Yeah, I hear you.
Oh,
You're
sorry.
busier than you were when you were working,
Yes.
right? Yeah, I know.
Yep.
That's what I found. It's like everybody goes, "Oh, you'll have plenty of time." Yeah, really?
Yeah, right.
MPHN nursing report.
I
Any
really
updates?
have nothing to update. I haven't had to come in contact with Sandy, other than the fact that one of the addresses in Hubbardston was reported wrong. So she got that fixed for us. But she's been quiet.
I don't see anything under field systems, past failed Title V's or permits items.
Nope,
What?
haven't gotten anything new, but I do know they're coming. So probably next meeting we'll have a bunch to go over.
And now for the list that is just ever growing, open
Just
repairs,
ever-growing.
inspections, and plans and review. Kathy and Mallory, the Kathy and Mallory show.
Kathy, have you done any final inspections?
Yeah, who did I do? One second. So I did, let's see, perks that passed were 69. Yep, they're there. 56. Yep, waiting of plans. Okay. I guess the last one I did was Brigham Road. That's off now, right? It's off the list. Yep. Okay.
Correct,
Nope,
Brooks.
nothing else.
And the rest of the open repairs, inspections, and plans are status quo.
Yeah.
What about 10 Main Street? Any news on that?
So they actually, yeah, so she called me on Monday and they are gearing up to probably, hopefully get things started in the next 2 weeks.
Has their loan been approved?
Yeah, we voted to approve it already. So right now the assessor is working on the final pieces of the paperwork.
Well, I knew he approved it, but that's what I meant was the.
Yeah, he's doing the schedule of payments and he just has to commit it to Sandy. So the tax collector. So it gets added to their bills. And then after that, it's they're the ones who will kind of monitor and make sure payments are received. So that will be one that we can check off for good.
Mallory, remind them that, you know, bed bottom needs inspection and all the rest before they just go ahead and put it in. Whoever it
Yeah,
is.
the installer should know that because that's their license that can be revoked if they don't.
Yeah, just remind the owners as well.
Absolutely.
Because a lot of them don't know.
All right, so we've covered open repairs, inspections, plans and review, and parks. And unless we have anything else, we can move on to open complaints.
So we still have 248 Gardner Road. I don't have any updates on that one other than the planning board met last week and it was decided that the chair is drafting a copy that 2 of our board members will sign on behalf of the board to submit to the select board and the zoning enforcement officer.
Yeah, I haven't seen much progress, but then again, Dennis, and so I just let everything kind of slide by because he was pretty sick for a while, and then you know, the snow came and COVID came back. So, but I drive by and I always look to see if they're doing anything, and I don't think they're really moving on anything. I think it's pretty much the same as the way it was the last time I looked, even though there's been such a passage of time. And I know Craig has been up there a couple of times trying to talk to them, and I just don't think they're. I think their mess is beyond what they know that they can do with it. So I think they're going to need a push, and they're going to need, you know, a little bit of advice.
Has Craig ever, because ultimately, you know, it doesn't fall on the tenants, it's going to fall back on the property owner.
Right.
What about, has he ever thought of like eviction and evicting them from the property?
You know, this particular family has been pushed around. This is not, this is another case where they have big dreams and then the big dreams get way ahead of them. And they've done so, but this is a repeat pattern. And I think Craig was just trying to be nice, and I don't think he's really willing to throw them out, especially in the winter.
Right.
But he may have to consider that.
I mean, obviously we don't know like and it's not for us to evict them, the history of rent or anything like that, but there's other reasons why you can. And if you're going to be getting pushback from the Board of Health and other boards on activities taken there, then.
Yeah, I think if they just got in there and you know, had somebody remove the cars, donate them to what kids,
cars for kids
or whatever, you know, and get rid of it, because they can't even get up to the trash pile because they got cars all lined up and down the hill. You know, they're all lined up, but they're all up and down the hill. So I think, you know, that's the first thing I would like to see is them go in and take all the find out what car is registered, what car isn't, and get the cars that aren't registered, get them out, donate them. I know they don't get any money for it. They only get a tax credit, but so be it. It's got to go. But that's not our.
No, that's not our purview.
No, no. And I think that's probably a first step, because then because if somebody goes in and says, this has to be removed by X, Y, and Z, that may be the push that they need to get everything else straightened up.
Well, it could come under our purview if in fact these are junk automobiles that may have some type of leakage of oil or gas or any type of hazardous waste into the ground. And I, obviously we haven't had our site inspection there, but maybe that's something that needs to be done. Weren't we supposed to have a group go up there and check it out with the building inspector, the conservation, and us?
There was supposed to be some sort of, I think we had talked about having some sort of inspection by zoning or whatever. I'm not sure which board.
Well, the boards, I think, involved that have any jurisdictions is the Board of Health and perhaps Conservation if there's a wetland violation. Other than
Yeah,
that,
the Board of
it's a zoning
Selectmen.
enforcement officer issue because there are zoning issues. So if we're going to take any type of action referencing health situations, we need to know what those health situations may be, i.e. trash, rubbish, vermin, perhaps hazardous waste. I think that's where we come in with the issues. And again, I thought we had some kind of group set up that we would all go up there at the same time and look things over, zoning looking it over, health looking it over, and perhaps conservation looking it over.
Yep. So where we left
Yeah,
it from the
I'll have
last
to-
meeting was what the planning and zoning board
Yeah.
were putting forth their own letters. We were asking them for any information they may have on the properties. And then they're going to send forward letters. We delayed any additional letters from the Board of Health until this meeting. So if we want to send additional letters, we can. And my question for you, Mallory, was going to be if the zoning and planning board had any other information that they were able to share with the board.
Really not. So everything that's in the file folder that we have, and I've submitted all the police reports.
Mhm.
It's pretty much just a pattern of people saying, oh, there's a problem, and then it trails off. Police go up, oh, there's a problem, there's all these vehicles, and then it trails off. We burning piles of trash, burning mattresses. So it's gone, like it's obviously been brought to a lot of people's attention, but there's never been any serious follow-up. Another board that we have to involve too is that the planning board was talking about, the Board of Selectmen, because they're the ones who issue junkyard and dealers licenses.
There are no junkyards allowed in town. There are no permits for junkyards.
Right.
Right. But they're the authority that would be permitting that, the class 2 and 3 licensing.
Do they
So-
have those licenses?
Bobby,
Those are licenses for the sale of automobiles. I don't see any of,
one for the sale and one for junk pieces, and they don't hold any of those permits.
That's what I was wondering. So if they don't hold it, then somebody who can walk on the property and say, this is an unregistered car, it needs to go, and it needs to go by such and such. That's the person that needs to go there and talk to them about the cars. And that would be an excellent push to, to say, hey,
That would be the police.
that's zoning. But again, if there's any leakage, that's perhaps where we come in with the hazardous waste situation.
you won't know that until you get the cars moved.
Right. So where does the board stand in terms of communicating to the zoning board, planning board, select board that we would like to take a collaborative action with them?
I think that's exactly what we need to do is reach out again to all those groups, including the selectmen, about the site.
Do we invite them to a meeting? Do we ask for a separate meeting? Do we attend one of their meetings? What's the typical process?
I think first we should draft a letter. That way we have a paper trail.
Well, I would recommend a letter going out to the owner and or whomever is running the business and requesting or insisting that we do a site visit on our own. And members of the Board of Health go up there and ascertain whether or not there are issues that we need to be involved in.
I think that'd be fair. and simultaneously send a letter to the multiple boards to start getting a coalition together so that we can actually do a group inspection.
And any issue that we have, if it results with some positive issues that we don't want to see, we can then issue a cease and desist order on that property for them to stop the business and stop the pollution and stop the waste of that land. But we don't know that until we do that site visit and make our determination. You know, and that's typically how everybody does it. You know, they have a site visit for a determination and then a report, and then action is taken.
I think that's good, Vin. We should do that.
And, you know, obviously I'd be willing to make a site visit with somebody who'd like to go.
Well, I've already been up there 3 times. So, but I've been at the top of the hill looking at the trash pile. So I really haven't, dealt with the cars.
So you
Except-
haven't made an official visit. Have they acknowledged the fact that you are a member of the Board of Health and you are on their property?
I talked to them once about it and they told me they had a plan and all that other stuff.
So when you go out to do this official site visit, a report needs to be filed, and we have 24 hours to get that report to officially back to the office. You have to cite all the code violations from the Mass Sanitary Code, and then a letter and a copy of the report and a time frame of when the violations need to be taken care of has to go out to the property owner as well. So I can give you a copy of that the blank site visit form that kind of references where in the code you might find certain violations. But if we're going to be taking this further than just, or we've noticed a problem, it may end up in court. We need to make sure that our paper trail is clean and correct.
Okay.
So let's start with the letters to the owner and the renter and contact the selectmen and the other 2 boards to work on the coalition. Vinny, I have done house inspections in the past, property inspections. So I understand exactly what you're saying, Mallory. So maybe you and I should do it, Vinny.
That'd be fine.
Okay.
Can we, I hate to do this, but can we do it in January?
Sure.
Well, maybe before then, if it all works out.
Right now, you can't get to the trash pile at the top of the hill because of the snow. I mean, the only thing right now that you can probably deal with is the cars and finding out whether they're registered or not and whether they're undrivable and maybe perhaps leaking oil and other things like that.
So I guess if we get the permission of the landowner first, then we can set up a time.
Yeah, I would do that. I would talk to Craig and see what he wants to do.
Is Craig the owner of the property?
Yep. Craig Halfrey.
Okay. So we have a plan for 248.
They're nice
Gardner Road.
enough folks. You know, it's just they're going in circles and they need a push.
Do you think that maybe this is a situation where the tenants are beyond what the landlord can deal with? You know what I mean? I don't mean like, you know, like they can't deal with it, but maybe this has gone a little further than the landlord expected.
Oh yeah.
You know?
Yep.
So that's what I'm.
And I think the tenants themselves have, like I said, they had a dream and they didn't execute it very well, and now they're kind of sinking and in their own mess.
I know it's like, what was that dream? Was that dream a car fixing place or a junkyard or?
Right.
And then there's the trash issue at the top of the hill, which doesn't even seem to be related to the car issue.
No.
I don't see where that's even related to each other. It's like they've got 2 separate major problems there. And maybe the landlord is overwhelmed by this. I don't know.
I think the
And,
trash.
and the trash at the top of the hill was somebody they knew that they gave permission, which they should never have given permission to quote store things until he could get them recycled, I guess it was. And they said, okay. And then that just got out of hand. They really had no idea what he was doing up there. They had just sort of given him a blank check to just, because when we went up there, when I went up there and I looked around, I was with Dennis and I was also with the Newtons because some of the trash was on their property as well. And, there were addresses. So what they told me at the bottom of the hill, what the tenants told me was exactly what we found at the top of the hill. These were houses had been emptied out, and this was stuff that somebody had an idea they were going to be able to recycle and get some money off of it by cleaning out people's homes and then recycling the stuff they found there.
So
But-
so they asked the tenants if they could do that, not the landlord. So the
Correct.
landlord didn't give them permission to do that.
Nope.
Wow.
Okay,
We have a plan of action on 248, 111 Gardner Road.
I've got nothing on that.
there's still no dumpsters, so I think it's time to do the same thing. Tell them that we send them a letter that we want to make a property inspection.
Sounds good.
And then 19 Mount Jefferson.
Yeah, so I just kind of wanted to bring it to everyone's attention. This was a complaint call that I got in that really wasn't a complaint, but I didn't know where it was going to go when we was putting the agenda together. So we had gotten a complaint call from 19 Mount Jeff that there was, or actually an abutter of 19 Mount Jeff, that there was some trees being removed, a road being put in behind. People were digging up rocks, people were doing this, people were doing that, and they didn't know why. So I called Kathy. Kathy went up and took some pictures, and I don't know, did you get to
Yes,
interact?
it's all related to the septic system that's being
Right.
put in. And
They were just
everything
doing-
on the correct property side, it is on 19 Mount Jeff's property. And it has no real bearing on the abutter.
So yeah, I think the neighbor's main complaint was that there was some shade trees that were taken down and some leaves and sticks that kind of were cleared, so it cleared up the vision so you could see the neighbor's house a little clearer. But they didn't have any tooth in what they were reporting. So, but I didn't know where it was going to go at the time. I just wanted to put it on there just in case it was something real we needed to be concerned with.
Okey-doke. Anything else on open complaints before we move on to new business?
No, ma'am.
All right, new business, Title V loan request, also 19 Mount Jefferson.
So she updated her application for you guys with the correct amount. And she also refilled out the signatures and all that good stuff. So she's asking to borrow a total of $24,380, which is what was on the estimate. And now we have the correct documentation for that. She had her approved plans. So she is ready to go.
Okay. Do
I
we,
make a motion that we approve the septic loan for 19 Mount Jefferson Road in the amount, you said $24,380, correct?
You got it.
correct.
Yes. I make that motion.
I'll
Right, do we-
second it.
Thank you. And Judy? Yay or nay? We're going to take a vote. Judy, I couldn't hear you.
Said I'm fine with it.
Ben,
Yes,
Colleen,
Yes.
Kathy,
Yes.
and Kate is a yes. The vote passes unanimous.
so I have a follow-up question on this, if I may. I think it's it's fine that we're going to be lending this money to these two parcels and perhaps even others. What do we do if we have a depleted fund and have another request? Is there an avenue that we can borrow money from the state or DEP or whomever? Or do we just have to wait till the payments come in to replenish the fund?
Right,
Yeah, it's gonna have to
Yeah.
replenish itself.
right.
Yeah.
That's the way it was set up right at the very beginning. You spend what you have and then you wait for everything to come back.
Okay, so
We-
that's gonna take a while. What if we run into another situation where we need funds? Is there a government someplace available that we could tap into if we needed to? I'm just thinking in terms of contingencies down the road.
For septic plan repair?
Yeah, I mean,
I mean,
let's say we're out of money. I don't recall how much we have in the kitty, but let's say we're out of money and somebody comes in and needs another 25,000. Do we have an avenue that we can tap into so that we can replenish it and lend that money back out so we get those repairs done?
The original was a $200,000 gift to set up the recycling by the state. I mean, recycling the money. It was set up by the state. If I remember right, it was 200,000 was the original amount.
I believe so, yeah.
Yeah, I don't know how much is in there now, but that was the original amount. And it
Yeah.
was just set up as a one-time, this is the pot of money you get, and this is what you should be doing with it, and how you blow it or how you keep it is up to you.
So we have about after this one, we'll have about $100,000 left. And we have, I believe now after these two, we'll have 4 or 5 active loans. So at one point there was some issues with how they were recollecting the money because it's supposed to be put onto your quarterly tax bill. And they were doing monthly payments. So, but that all got fixed and everyone's on the same page now. And
I think the way back at the very, very beginning, it was a lien on the house. And that's why it was set up as, but
it's a betterment they put on.
probably the better way to go.
Well, absolutely a lien, but maybe we should also ask the people who are borrowing the money, if in fact they're borrowing it to fix up the system and to sell the house. If they do that, that gives us a timetable where we would regain our money back and have it so that we would know when an additional set of monies would be available for the next applicant.
So yeah, so 19 is doing that. She's planning on selling her house. So as soon as the money goes through for the sale, this loan will be paid back in full at 5% interest.
Okay. Well, that's what I'm getting at. Now we're developing some kind of methodology so that we're not broke. We can say to the next applicant, we'll have a sale of a house in 30 days and that money will be repaid and then we can lend it to you. And that keeps the revolving fund going and people know when they're going to have access to those funds, as we will have that information.
right. But I mean, the chance does exist that we could end up with more applicants than we have loan money, and
Yeah.
it becomes a first come, first serve situation where we don't have it out of the pool of funds until it's replenished from tax collections.
Yep,
And I-
and that has happened.
Yeah, and I know there's private entities and private foundations that will help if there is like financial strain. So it might be harder to access those funds than it is to access the funds that we have. But I don't think that there's other people to help Vin if that ever comes to it.
And Mallory, what's the interest rate on a loan? This is my own curiosity. For
5%.
it's just 5%, period.
Mm-hmm. 20 years, 5%.
I mean, Vin, not for nothing, but if it was me personally and I was taking out a loan, I needed my septic repaired, I wouldn't go through the town because I could get an unsecured personal loan at 2% right now.
Oh,
As a
well,
homeowner with good credit, you know what I
what
mean?
I'm trying to establish is what we have in terms of rotating funds so that we always can advise people it'll be available here and they can make their own choices. I'm not advocating that they borrow it from us. But the other concern I have is to make sure that when the money is recaptured, it doesn't go to the general fund, it comes back to us and it is put back into this particular fund. So I don't know what the instrument is that the tax collector would put on the property, but when it's recaptured, we should have first dibs on it because it's basically our money.
It goes back to the fund.
Yeah, and that's when we do the fund review before the, warrant cycle in June and
Okay.
town election. And as a board, we review the funds and the budgets and the line items.
And every time we get a monthly budget versus actual, the Title V loan is included in that. So we can see that fund monthly. And anytime we want, the accountant would give us a detailed itemized what's in, what's out with the click of a button.
Good point, Sovin.
Definitely.
All right. Anything else on the Title V loan before we move on? Okay. Health inspector.
So we have gotten one applicant for the health inspector position, Tim Newton, and I forwarded over a copy of his resume to the board. So I don't know if you had a chance to review it or not. Kathy, Ryan, and I will be doing a interview with him on Thursday at 10. So I kind of wanted to put it out there to see if there was any, like specific questions anyone had, or if anyone had any input prior to, or.
Right, because I really need to step out of doing all this septic stuff.
Thought the resume looked very good. My only question was, is the distance that he's traveling an impediment to timely inspections? And if we need them, is that going to be a big deal coming from Greenfield?
So he actually lives local. And I don't know what his schedule in Greenfield is.
I noticed that a lot of his stuff on the resume was out of the Marlboro area too.
Yeah,
Is he traveling back that far?
no,
Far east?
no, he's in the Athol Orange area.
Oh, okay. But he did have a lot of references to the Marlboro area.
Yeah, I think he's relocated.
Okay.
Yeah, those were previous employments.
He's on the Conservation Commission in Orange right now.
Okay, that's good to know. Yeah.
Yep.
So
Yeah,
we
the
have-
resume looked like he was still going to school trying to get his bachelor's degree. So, but it looks like he's got a really strong interest. I mean, his experience is somewhat limited by, I think it's like 5 or 6 years total. But, it seemed to indicate to me that he really had a really strong interest in this field. And so
Yeah.
that was a big plus for me.
Yeah, I mean, you can expect in terms of a, job path for somebody graduating with environmental science that if he's doing health agent and health inspector, that, he may very well end up being the health inspector or Title V inspector for a municipality full time after graduation. So
he's a full-time in Greenfield. And actually I kind of had he spoke to me on the phone briefly. His career path or that he sees himself going towards in 5 or so years is he'd like to work for the state, doing inspections and something along the Board of Health lines. He isn't sure yet, but.
yeah, the only concern I would have and the thing I would grill him on in an interview would be time management, given that he has a full-time job at, 2 essentially, right? He's doing
Right.
inspections for Greenfield. He's a regional health agent for, New Salem, Plainfield, Greenfield, and then going to school as well. So I'd like to understand, like, I would actually ask him, what's your schedule like weekly? How many open time slots do you have in the next week?
Right.
Things
That
like
was
that.
that was one of my concerns that I wrote down for when we go into this.
Yeah. I can't imagine. I mean, I think Greenfield's probably similar to us in terms of how many businesses they probably have functioning at the moment. But
Yeah, and it sounds like in Greenfield his duties might be split. So he's not doing everything. It sounds like there's multiple inspectors from me researching on their website.
But he served safe and,
Mhm.
you know, has the experience. I think overall a really good resume.
He's managed a business with a kitchen too.
Hmm.
Mm-hmm.
So, all right. I'm looking forward to the results of the
Yeah,
interview.
good luck. That sounds like an interesting conversation.
Thank you.
All right. Board of Health ability to assess fees. So I forwarded 2 documents. Have you guys had a chance to read them? And do you have questions about them? One of them is a permits and fees explanation of authority. And that's the document that I found while searching
right.
that when I asked Ryan specifically, this is what he sent me back as well. So this is, I mean, I think it pretty concisely outlines what the, where the boundaries are. And I think it gives us a clear path to review our fees, not necessarily with the intention of raising them, sometimes maybe lowering them, but level setting them with the local community and making sure that the fees we're collecting and the volume that we're collecting them is enough to cover our administrative costs, especially given added services. The increase in services, increase in the need for permitting and inspection.
So I don't have any problem with any of that. So what do you think the next step will be, Kate?
I think it's just going to be a working session. I think, take up a little bit of Mallory's time and, one of us, I'll volunteer to go through, look at the fee schedule and look at roughly how many we've issued. Like, I don't know if we have a way of calculating that easily, Mallory, for like a period of time, 3 months, 6 months. And then we can look at the expenses and just have a working session. And then the 2 of us can bring our findings back to the board if we think things should be added, increased, decreased, or struck.
Perfect. And I've actually already started to doing
I knew you'd started.
a comparable where we are versus where what we don't have in other towns. We have like a set 10 communities that we can compare ourselves to,
Right.
which we don't have a set of communities in Hubbardston. So I've been looking at comparable in size and population. And services, do they have public sewer that they have available to them, or is it all private like it is in Hubbardston? So I've kind of started to take a look at that and what their fees are. Started putting so.
Okay, but if you want to pick a time and a date and
Sure,
tell me, I'll just put it on my calendar and block it.
sounds good.
Shoot me some dates and times. And you can if you send that to my regular Gmail,
Okay,
I'll see it during the day, like a normal working day, and be able to check my work calendar.
perfect.
Okay. I'm yours to schedule.
Fantastic.
All right. EDS drill 1223 we already covered. Unless we have anything else on that. December meeting schedule.
Yeah, so I kind of brought this, put this on the agenda. So our next meeting is December 22nd. I have requested and been approved for the 22nd to the 4th off, which is the 2 weeks. Ryan has given us the 23rd, 24th, and 25th off. So I'm only using 4 vacation days, but last year I gave back 4 weeks of vacation time. And I didn't want to do that again this year, and I don't foresee my load lightening up in the spring. If anything, it's going to get harder with the vaccines coming out. So I wanted to use a little bit of it now. So I'm going to be off the 22nd, and I just didn't know what you guys wanted to do for meeting. If you wanted to skip it until January, if you wanted to have a meeting a little earlier, because I mean, it's really just next week, but
Well,
someone else wants to run the meeting, or I don't know.
feedback from the board. What do you guys want to do?
I think we could skip it.
I'm cool with January.
Seems to be our month. This is the theme.
Judy
That's all right.
I'm fine with January too.
and Ben.
Yeah, I don't see anything pressing that needed to be discussed. We got a pretty good agenda here this evening to compensate for December 22nd. So if we came back in January, I think we'd be all right.
There's your answer, Mallory.
Fantastic.
The
So I'm
board
still
is-
going to be, I'll be on my emails every day and getting out the EMS and police reports with the COVID house numbers and stuff like that, and available for anything emergency. But so if anyone needs me, you can always email. I'll be checking that throughout the days.
But Mallory, we're not doing this to accommodate you. You understand that. This is business. So we're doing
I totally understand,
a
100%.
logical decision based on what our business is. You know, not giving you any Christmas presents here.
You get 4 days off this year, and that's it.
Yeah, right. Back to work.
All right. We had the assessor request in the discussion with them earlier. So moving on to old business, we have food inspections. Still on the list. What's even open? Westfield Farm.
Capri.
What was that, Mel?
Is it Capri? Is that what it's called? The goat
Yeah.
cheese?
Westfield Farm is the
All
one,
right,
the big one that's outstanding.
all right, that's open, yep.
Yep. Let me take a look. Literally the only day I have is the 23rd, and nobody's gonna want to get an inspection on the 23rd. I'm just saying. I'll do my best to get it done between now and sometime before, maybe the next week. Maybe next week. I'll give them a call and see if they can find a time next week and go get that one done.
Wow.
Okay. I think that's the only thing. I think we picked away the rest of them. The others are either non-functional or not open at the moment. I would appreciate, though, the next time we have to do like mission E4 or whatever, that somebody else do it, because I just get creeped out every time I go there. I don't know. I don't
So
have a
Tim,
better way of putting it. There's not a good political way to say it. It's just like the most uncomfortable inspection ever. And I just don't want to
Maybe
do it
we'll have
anymore.
somebody on staff by then.
Maybe we will. Mallory, go ahead.
Yeah, we can definitely delegate them to do that. And so,
Gotcha.
yeah. Oh, sorry. If we have someone on our staff that's available, we can delegate them.
Okay. So I've done the last 3, and I'm like, really? And then budget spreadsheet is the next.
Everything looked fine on that. Thank you for including it, Mallory.
Welcome.
And any other unexpected subjects?
I have a quick point, Mallory. Are the letters going out now for 2021 permits?
Yep, they actually got put in the mail this afternoon.
Thank you. Sounds great.
Yeah. And I used the new food permit that we approved last year too. So we'll have a lot more information on like persons in charge and emails and communication. So that'll be good.
Thank you.
You're welcome.
Anybody else? Other topics?
Well, Merry Christmas, everyone, and I move to adjourn.
All right, we'll take a
Merry
motion to adjourn.
Christmas.
I'll second that motion, Vin. All in favor?
Aye.
Aye.